Om Shanti, greetings of peace, good afternoon, good evening. Welcome everyone for today's Monday Insight session. And well, some of you might have seen the flyer and know what it is. November 14th, the world celebrated as the World Diabetic Day. So in honoring that, in a step to create awareness, we are hosting it today. The theme is Living in Balance. So just to kind of get a feel, how many of you know what is diabetes? Anybody? You can shout out, yes, I know. You could chat. Is also okay. Yes, that would work too.
That will work too.
That would work. What is the feeling when you, I don't wish anybody to be diagnosed with it, but it's a very fairly common word. Oh, do you have sugar? Do you have high blood pressure? Of course, we'll get to know more about it, understand more about it. And what are the different types? Is it something that I have to live with all the year, all my life? Is there a way that I could do something now so I can prevent it? I am very young. I've been diagnosed, or nobody in my family had. Why did I get it? I don't smoke. I don't do different things. Why do I still have it? So many questions, so many misconceptions, so many myths. Just to understand these things better, it's always better to know from the expert itself. I will need to use my phone because the expert are pretty in detail, right? So today we have Dr. Ramdev Jainarayan, who is both medically and spiritually educated, and he has been practicing Raj Yoga and medicine for about 15 years. He specializes in internal medicine and infectious disease, and also has a subspecialty in nephrology. He's also an assistant professor at the University of Guyana. He also coordinates he's a country coordinator for health volunteers from overseas. And of course, all of us at the center and probably his friends very fondly call him Brother Vicky. Yeah. So there's a huge difference between Dr. Ramdev and Brother Vicky. So let's please welcome him on stage. And as he's making his way up, bringing us the insights of the medical field, we also have another expert with us, and that is Alisa Zaver. Shaver, thank you. I was going to ask you, how do I pronounce that? Now, hers is a thesis for me to share, but just to give you a taster, so she's a highly trained exercise professional with a master degrees in exercise science and a minor in nutrition from Miami University of Ohio. She also holds an autism spectrum certificate and completed specialized internship in cardiopulmonary exercise physiology at Cincinnati Children's Hospital and adaptive fitness training at the Shirley Ryan Ability Lab. Goes on, goes on. All right. Let's to give us a little more. I'm going to skip and give you the nice ones. She's a lifelong athlete. She has been a goalkeeper for the hockey team. And she's also served as the goalkeeper for the Guyana women national team for 20 years. I didn't want to ask you how old you are, but that's fine. She later coached both the men's and the women's Guyanese national field hockey team. And also she's like a fitness trainer, programmer, senior, and okay. At present, Alisa works with a diverse range of clients, including competitive squash athletes, seniors, individual recovering from stroke or traumatic brain injury, young youth athletes, people living with diabetes, and postpartum women. I had to skip some of the things because it was quite long. Please welcome Alisa on stage as well. Yes, that's the athlete way. So, so since we have our two expertise, we will share. We both will share this mic, and she can share the other mic. Um, I think first it's important to know what is diabetes, and if you can shine some light on it. If I'm hearing it for the first time, all I know is sugar. No sugar. How is it related to it? And yeah, a little bit more on that, Brother Vicky.
Om Shanti and good evening, everyone. I quickly signed in on Zoom to see who our audience is before I came on stage. And I believe we know most, if not all of you. So the nerves are a little bit less. It can be less for you too, Alyssa. um, so, you know, diabetes, sugar, um, I believe there's that relationship between the two because technically diabetes is sugar in your blood, or too much of it rather, because there should be some, but too much of it, and the one we're talking about is glucose. So because there is too much glucose, you become sweet. And one of the ways they used to diagnose diabetes before was when people's blood, if they got prick or cut and their blood dropped on the ground, they noticed that ants would get close to it, and that was a way of knowing that you were sweet. So, a very uh, a simple way of making the diagnosis. But now, we have more advanced medicine. The disease is the same, but we have more advanced medicine. And so now when we talk about diabetes, um, it's really and truly to do with insulin and the hormone that's responsible for pushing sugar into our cells so that we can function normally. So, all of our cells need sugar, including our brain, our heart muscles, our kidneys, whichever organ system of the body that's made up of tissues and cells, they need sugar to function. And so the hormone that is responsible for pushing that sugar into your cell from the blood is insulin. And diabetes is really to do with either an absolute or relative reduction in insulin. So absolute meaning that there's no insulin at all in the body. And this is just because the pancreas, which is responsible for making insulin, the beta cells of the pancreas, it has it has been destroyed, it's destructed. And so there are no beta cells to produce the hormone. And so you don't have any hormone at all to do that function of making you get the sugar that the body requires. And so that is generally referred to as type 1 diabetes. And then relative reduction, meaning that the pancreas is doing some work, um, but also with it doing some work and making insulin, there's actually resistance to that insulin that the body is making. So there are two things happening. We could say not enough insulin, and then there is resistance to that insulin that the body is producing. And so what happens as a result of that is high sugar levels. The medical or scientific word is hyperglycemia. And you can have no symptoms with it, or you can have symptoms with it. But before we go on there, I just wanted to check again with everyone who's listening, inclusive of us here on the stage. Any doubts? What has been your understanding, or how did you? I don't know. How did you grow up knowing about diabetes? What your I don't know, your nanny or your aji or your grandma used to tell you about it. I for one, learned a lot about it through my paternal grandmother. I used to call her Nani, but not really and truly, she's my Aji. But yeah, everybody used to call her Nani, so we also used to call her Nani. But I was very close to her, and because I was close to her, I was also very close to her illnesses as well. She's had diabetes for a long, long time, and she's had, if I remember right, about 3 strokes. So, I was very involved in her care as well, in that, she had to be fed, she had to get her medicine. So I learned from a very tender age what diabetes medications look like and all of those things. And I also watched her struggle with the disease as well, because she had her own ways. She was very fixed in her ways, and when she was taken to the doctor and she comes back, she'd always be complaining about, he stopped me to eat this and I can't eat that, and why, why do I have to do this? And I want to do this, and I like this, and I don't like that. Um, but I think um, I also watched her come to grips and come to terms with it, especially after her second stroke. She really understood that what was said to her was for her own benefit, and she herself started to do these practices. So yeah. And it's very prevalent in my family on both sides. My mother's side, both my grandparents on that side were diabetics. I don't know much about my father's father, because he's already passed on when I um, was big enough to know who my grandfather was. But like I said, my father's mother was diabetic. Quite a few of his brothers and sisters are. Same so for my mom as well. So I have a really very strong family history um, of it. And on that note, we used to say, "Oh, it's genetic and it comes through and run through the family." But the statements around that are changing, because it's not really so much about genetics. It's so much more about lifestyle and your own choices. So, if we were to speak of risk factors of diabetes, it would be things like, maybe just to put a little bit of, softness on it. It's laziness, really. It's living a very sedentary life, not very inactive life. So that's one, not being physically active. And second of all is the things we eat. Yeah. And maybe not even so much the things we eat, but the quantity of it that we eat. Yes. And the focus of our diet as well, which is purely, carbohydrate driven. Um, and then the only other risk factor I'd probably add there is if you have an issue with weight already. So obesity. So it'd be obesity, physical activity, and our diet. Those are the three main risk factors if we were to pinpoint for diabetes. Okay. So I feel like I'm teaching. I don't like to teach. So tell us something, those on Zoom. Tell us what you know. You want to add something, make a comment.
Om Shanti and good night.
Good night. We can hear you.
Yeah, the first I exposed to a diabetic person was my father-in-law. He was diabetic and he couldn't eat many things. So I learned couldn't eat bread, he couldn't eat many things, but I learned from that. Thank you. Others can share.
Nobody wants to talk. So Alyssa wants to say something.
For me, my experience with diabetes, my dad is diabetic. His mom was also diabetic. Sister Sinead. She was also diabetic, and his own was more of lifestyle in terms of like being overweight, things that he ate, so he developed it later on in his years. But he also like had the foot ulcers and these things. And had it not been for my mom, who was taking tender care of his feet, he probably would have lost a toe or the foot itself. But also my clients, one was type 1, so on insulin, and the other type 2. But the type 2, she was asymptomatic. She didn't show any signs or any symptoms of hers until I gave her massages. I was her massage therapist. And then I realized that her feet were not healing well. So immediately I went to her doctor, her first. And I said, you should probably go and get a blood test check. And it was skyrocket. And I'm like, how, like, you were without symptoms and like, can I tell you, like 300s, right? So how are you without any symptoms, moving around inside of the gym and things like that? But I feel like for her, almost like the exercise that she was doing kind of aided in some way. So even if it didn't manage the sugar well, it did help in some way to almost mask or help reduce some of those symptoms I think she was having. But now she's taking medication and her blood sugars have dropped. She did her nutrition and doing her exercise. But my type 1 client, he it's funny because he was a twin. So I trained both of them. One had Parkinson's and one had identical twins, diabetes. But he was tested for Parkinson's. He didn't have Parkinson's, and the other one didn't have diabetes either. So yeah, which was interesting. But he was of the notion that if you leave a car inside of the garage and you don't move, he didn't like exercise. He didn't like anything to do with it. He was like, his body is going to be fine. He doesn't need exercise or anything like that. So him and his brother used to battle. I rather I have Parkinson's. And he was like, I rather have diabetes. And I'm like, but when I tested both of them in like different, for Parkinson's, you have to do like balance tests, Berg test, walking gait analysis. When I tested the one with Parkinson's, the one with diabetes looked like if he had Parkinson's. And that was because of his inactivity. So, the one with Parkinson's was active and exercising and stuff. And I was like, you sure you didn't go and get tested for Parkinson's? Because you shuffling your gait, like you stepping over these obstacles, you're like off balance, like your hands are moving, like left hand, left leg, moving like, and I was just like, this is very, very interesting. But yes, that was my experiences with and actually, when that time comes, we'll talk about it in terms of like his time in or eating and how exercise affected it.
So, just to do a quick recap, one is we understand what the definition of diabetes is and the two different types of it, and whether they are symptoms or not symptomatic, what is the whole ray. So, what if my sugars are high? How is it, like, so what if my sugar is high? How is it wrong? And I have no symptoms. Should I be even taking care of it? And either accidentally, when should I even be getting testing myself? Wait till the end, or should I have like, okay, let me do an annual check and see, I wait till 40? Should I wait till 60? That was one of the thoughts that I was having, that I should clarify what are the symptoms. And yes, I understand diet plays a role, sedentary lifestyle plays a role, history, but there is also a role of stress. We call stress-induced diabetes. So this role of that also these days, at a younger generation coming up with diabetes earlier. So yeah, about testing, do we really, and what is, so what if I have high sugar? I'm sweet.
You're sweet. All's okay, I'm sweet. So yeah, so maybe what we should do is add stress to the risk factors. So far we have 4. And I think as we go along too, we'll be adding more risk factors. So certainly stress plays a role in not only developing diabetes, but it plays a role in also taking care of diabetes. Because we get stressed, then what happens? We stress eat and we lock ourselves in, so we become less active. So they add already to the 2 of the main risk factors for your sugars going uncontrolled. So in symptoms for diabetes, so usually patients realize their symptoms after they would have seen their blood sugar check. So they get their sugars checked, either it be I don't know, for some emergent reason, in a routine evaluation. Lots of people find out that their sugars are high when they are going for their visas, for example. Like you're going for a Canadian visa, they would always ask for you to get a medical done. And when that medical is done, there is sugar in their urine, or there is high blood sugars. And so it's after that that patients would go in retrospect and realize that, oh, these are my symptoms for diabetes. Yeah. So they'd say, oh, I usually would get up a lot in the night to pee. So that's called nocturia. Or they'll say, I just pee a lot during the day. So that's polyuria. Poly meaning a lot. They would tell you things like, I used to feel thirsty a lot. So that's polydipsia. So, the increased need to drink. Um, or they may say things like, I had, yeah, weight loss is one. Is another big one. Or numbness and tingling to my hands and feet, or blurred vision. Blurred vision is also one that happens, or people are able to pinpoint after they would have seen their blood sugar. Because blurred vision can mean a lot of things. But then they would also realize that whenever their sugars go high, it's one of the reasons why their vision will become blurred. So, my mom, for example, would say, my sugar is high. Yeah, because our vision becomes blurred. And so these that we're speaking of course, are for patients or people living with type 2 diabetes. For the type 1s, unfortunately, theirs is a reason for a visit to the accident and emergency, and they may be unconscious when that happens. And this is called diabetic ketoacidosis. And so the body just goes in a different direction, and yeah, you get into, or you fall into a coma. And then we get we get the chance to bring you out of it. It's a pretty exciting case to deal with. I love patients with diabetic ketoacidosis, and it's so rewarding to take care of them actually, because this is one we will say doctor beside patient, and it literally means doctor beside patient, because you have to be constantly checking their blood sugars, constantly drawing their blood work, uh, rehydrating them, checking to see if the sugar is coming down, if their potassium levels are okay, um, and we do this thing called a blood gas, which is to measure the different levels of certain parameters in the blood that would give us a sense as to whether the acidosis, it's diabetic ketoacidosis, whether that gap is closing, because it tells us, okay, the patient is getting better, and so we know when to feed them, we know when to switch them to oral medication. So um, and this really pertains to the younger population, the type 1 diabetics. You can have adults who will present with type 1 diabetes, but their course is more gradual, because the way the cells get lost is a little bit more gradual. And so they even can get confused sometimes to be a type 2 diabetic. And so doctors may start them on the oral medications, but it does nothing, because the oral medications, what they do is stimulate the pancreas to make insulin, and you can't stimulate a non-working pancreas to make insulin. So if you notice that, or if we notice that, then you start to think, what really is happening with the patient. So Sister Kenry asked the question, so my sugar is high, so what? So we need to confirm the diagnosis, and the gold standard of testing is called the HbA1c level, and that really is your glycated hemoglobin level. So the sugar sticks upon the hemoglobin because it's so sticky. Um, and I'm remembering this formula that we would use in diabetic ketoacidosis. It's was it 2 sticks on a sugary bun or something like that. That it would last, right? So yeah, our red cells would usually live for about 120 days, so for roughly 4 months. And it's funny that we also check the HbA1c levels every maybe 3 to 4 months as well. So yeah, so it's the HbA1c levels. So that you are diabetic if your HbA1c is more than 6.5. But there's also this notion of pre-diabetes. I'm sure you heard of it, pre-diabetes. So these are for people whose range are probably between 5.7 to about 6.4. And we also would address concerns for patients with these numbers, because if there's any place that you can do preventive medicine, it would be here. If we are noticing that people's HbA1c levels are between 5.7 and 6.4, and so you get a little bit more robust about talking about exercise and diet and lifestyle modifications. So there are other ways of making the diagnosis, and of course you heard of it. So we prick people's fingers, we make their blood drop on the ground, and we look to see if ants come. Yes? So we don't do that anymore. But yeah, so there's the HbA, that's the gold standard. But if you do a fast in blood sugar, meaning after you would have restricted eating from about 9 in the night for about 8 hours, and you check the sugars The following morning, if your fasting blood sugar is more than 126, you're considered to be a diabetic. There's a test called an oral glucose tolerance test, so it's a OGTT. And we would leave this for the younger population. We don't do OGTT for the elderly because we don't, put them through fasting. But there's an oral glucose tolerance test, and it's actually a test that we use in the pregnant women to make the diagnosis there. Because you remember, it's the woman and it's the fetus, so the way it behaves is a little bit different, the sugar levels. So if after 2 hours of giving 7 to 5 grams of glucose, and everyone know what glucose is, so you mix that up, you make a nice slurry, and you give the patient the drink, and 2 hours after, if that is above 200, you're considered to be diabetic. And then there is also what's called the random blood sugar. So lots of us would have heard, this in the doctor's office or in the emergency room. Oh, what's his RBS? That's what you probably hear, RBS. So the random blood sugar, if that also is above 200, you're considered to be a diabetic. So, the diagnosis, it's not too technical. I like to confirm with an HbA1c, because once you do that, it doesn't give you a wrong diagnosis, because what it basically informs you is what has been your sugar for the past 120 days, because the hemoglobin or the red cell lives for that amount of time. And it gives you a fair idea as to also how patients are controlled, how controlled they are. Because when they come to see us, we're just seeing the sugar one time. Yes? They come to the office, and so patients are very smart. They will fast that day. They will fast that day and make it look good, as if to make us feel like, oh, they're doing well. And lots of times you'll have to take them through that conversation. It's not about looking well on the day of coming to clinic, but it's actually what has been happening, because we may see them only 4 times a year, like every 90 days or something like this. So what we have implemented, because we constantly need to implement ways of figuring things or keeping track of things, we have started a glucose monitoring chart, where at the end of the visit we'll give all of the patients this, for them to record their sugars over those 90 days and bring it so that we can see. Otherwise,
You have to do
it's
it
just
every day or once a
to do
week?
it every day. Yes. So the indications are, as a diabetic, you should check your sugar before you eat in the morning, 2 hours after every meal. So that's at least 4 times a day. And so, yes, it means a lot of finger pricks, but it means also more ideal control. And so now we have the implants, so where you don't necessarily need to prick your finger, but with your implant, you can just look at your what the plot is, and that would give you an idea as to what your sugar is doing throughout the day.
Definitely reminded me of my mom when she was initially diagnosed, and she's like, tomorrow I have to go for this blood test, and she would eat differently and all of that. And I was like, you're just cheating, And once we realized about the HbA1c, it's like, okay, this is like the gold standard. It tells you for a period of 120 days how you have controlled. Just for Elisa, what is the role of exercise in this disease? Whether it can prevent it, if there is a role that I can, or pre-diabetic, as Dr. Ramdev was saying, or after I'm diagnosed, because this is one of the risk factors is my sedentary lifestyle. And of course, there are a lot of combinations where my weight might not be helping me to do the walk, or I might be disabled, preventing me from walking, or my job is such that I don't have time to make exercise. They say, I don't even have time to eat, right? So you hear these things because of they're doing 2 jobs, 3 jobs. Like, where do I fit in exercise? Is it really important? Because diabetes affects every cell of the body, right? Whether it's my brain, my heart, my lungs, my kidneys, my liver, like even the foot. We're talking about foot ulcer. So every part is affected. So role of exercise.
I think exercise is, but it's more than just lowering your blood sugar, right? It can help with weight management, risk of cardiovascular disease, or helping you to repair after cardiovascular diseases, lower your blood pressure, lower your stress, and ability to manage. So I think like in terms of like people think of exercise as this long and grueling thing. Whereas if you get a little 10-minute, there's like a 10-minute rule, right? Where we say 10 minutes is minimum, right? That's your minimum. But if you dedicate yourself to just 10 minutes of walking, riding, swimming, whatever you have access to. And I always say pick something that you like. You don't like to go to the gym? Do not go to the gym. I have worked with plenty miserable people coming into my gym like, I'm like, go swim. You like swimming? Go and swim. But if you do 10 minutes, just 10 minutes, just something small for that time, eventually you will start seeing like some effects, right? You will start building a habit. You're going to say, all right, well, 10 minutes felt good. So you start really, really small. That's how I want you to start, and people get discouraged with exercise because they think that, oh, I gotta go and run a marathon, or I gotta lift so much weight.
Is that what you mean when you say flow with the go? Usually we'd say go with the flow. She said flow with the go.
That's flowing with the going. But when people tell me like they don't have time, like I say, well, then you'll have to inconvenience yourself. Are you sitting all day? Where is the water station? Make sure that you walk in to the station. Make sure you got to go to the printer. Make sure it's a little bit distance away. Try to inconvenience yourself to be able to walk more in the office. Get up every 15, 20 minutes, 30 minutes if you must, and just walk somewhere. Go get a coffee, go get a tea. Set things further away in your home. Put your phone somewhere else. In the morning, you gotta go and get up and walk towards it. So there's little ways that you could inconvenience yourself in a highly stressed environment, and it reduces their stress. So if they do exercise and they just give 10 minutes, whatever you have of your day, just 10 minutes of something that you like doing, just
It's also important to understand why we need to exercise, because one is, as we were hearing, there is a resistance for the glucose to get in. So when we do exercise, the cells become sensitive and they allow the glucose to get in. They come, welcome. It opens the doors and windows for entering and lowers the level of the sugar in the blood. It's very inspiring that you take little steps and build increments on it, because initially they were like, this is not enough, you're not sweating, you're not burning any calories, how is it going to work? So but that baby steps will definitely increase. You wanted to say something?
So and it's a lifestyle change. It's not I want my blood sugar to get better this week, or it's not I want to diet so that I can lose the weight and put it right back on. No, it's not that. It's more of a lifestyle change. So it's like you making this a part of your life, your routine. And so, Alyssa is gentle and generous, and she says 10 minutes. And I do understand as a coach why someone will say that, because you want to be encouraging. And I also, before I used to be very like dogmatic and say, no, you need to do 30 minutes 5 days a week because you need 150 minutes because that is what the guideline says and you must do it. But then you get a little bit of resistance or a whole lot of resistance to that. So we can't have insulin resistance and exercise resistance or Dr. Ryan resistance. So I started to be a little bit softer and say, the recommendations are this, but you can start with just walking. Um, I may joke with the aunties or the grannies and say, now you have to start to go to the gym, and they would give a chuckle, but then you kind of like ease them into it and say, start with walking, maybe walk 10 minutes away from home, and then walk 10 minutes back, because also you don't want them to do the 20 minutes away from home and they can't walk back. So and start with like walking, and you build on that. Maybe from walking you can brisk walk, from brisk walk you can jog, from jog you can run, and if you feel like you want to start the gym, then that's fine, but it's not like I have to break a sweat, and because that in itself, the thought of it in itself is overwhelming, and it's overpowering, and it shuts you down. You're like, okay, exercise, no, not me. So yeah.
Do you want to share any exercises that we could sit and do, or if you want to stand and do, I want to show us some things that, yes, walking is good. And how do I just walk like a stroll?
Brisk.
Ah,
As fast as you can.
Did everybody hear that word? Yes, I'm on my phone. Am I walking? Or, what is walking?
You want it to be like you want your heart rate to be at least get it a little bit up there. So anywhere like
How do I know my heartbeat is increasing?
talk. There's a simple talk test.
Okay.
If you're
You're catching your breath and
right, if you're walking and you're like, so this thing today is, and you're catching your breath, that's a good pace. That's it. That's a good sign. If you're breaking up if you're walking and talking like this and nothing, it's too slow, too slow. So that's how you would do it if you don't have a heart rate monitor or anything. But you want it to be starting out. You want it to be light to moderate. And you want to see how your body reacts to this, right? And especially if you're diabetic, first I would ensure that your doctor give you permission to go out there and walk and things like that. But if you're exercising and have like structure, whichever, it would be recommended to, if you can, to test your blood sugar before and then after exercise, because it does have an effect. Like people, I think metformin or Ozempic is not so bad. You can eat your meal and have that, and you could
Sure.
exercise anytime. But people on
insulin.
the insulin, right, and you eat your meal, is either you do your exercise before or after 3 to 4 hours of it, because you can get hypoglycemia. And also, if you are diabetic, a lot of the medications you can become hypoglycemic. And because exercise helps to reduce that, reduce your blood sugars, then, or make your insulin more sensitive,
Yeah,
I guess.
sensitive, right.
Then you should like carry maybe some orange juice or something along with you, because I've had clients in between the session, their little emergency thing patch is going off and they're like, oh, so they had to take orange juice or drink something. So that's also very important, your timing and exercise and things like that.
What
But-
Anisa is saying is really very important. So one is, as Dr. Okay, Vicky was mentioning about ketoacidosis, your sugar going high. But when the glucose goes down, that is also very critical because you can very quickly go to hypoglycemic coma. You can go and slip into coma, and that is serious and even dying. I know my mom would have multiple hypoglycemic attacks, so we would always keep something when, like, you get sugar pills and juice, or she would know, she'd start profusely sweating and say, okay. So you need to know your body, what medicine works, when you have to eat, and different things. It's not to scare you all, but it is just to become aware of this huge dynamics, or the array of things from before, during, and how do we live with it. So it can be very stressful. And I was reading the statistics and I was sharing, Brother Vicky, like 4 out of 5 people experience burnout of diabetes. Like, I'm done. I'm tired of this. And they will give up and they'll just binge into eating and doing things like that, or drinking, right? Which can be really hazardous to their health. So definitely having this meditation or positive thinking, and how Brother Vicky became very compassionate and not being 30 minutes 5 times a week. So I need to be compassionate with myself, understand that this body is important, and to take care of it as well, and take care of your healthy mind, because tension can release different hormones, chemicals, which will again raise your sugar level. So yes, so what about eating? Should I because again, as we heard from our past father-in-laws and in-laws and ajjas and ajis, that don't eat this, don't eat that, and that is the thing, right? You've grown up listening to it, but what is the right thing to do? Both of you can share your views.
So in a way, we're talking about treatment without saying that we're talking about treatment. So there are different pillars for the treatment of diabetes, and most of it revolves around lifestyle modifications. So it's diet, it's exercise, and it's medications. These are the 3 main pillars. And yeah, we're gonna add meditation as well. So I had a way of kind of making the connection, because of course we're not just talking about diabetes at an organic level, but we are speaking of it also at spiritual level, because things like diabetes, burnout, it means that that's having an impact on the being, right? So that's mental affectations that affects the soul. And then the role of stress as well, like we alluded to earlier, that if one is already feeling stressed, then it means that the way they take care of their diabetes will be affected. And so from feeling stress, I made the reference to binge eating, but you can sort of like stress eat as well, to try to because you're looking for another high, right? Because you're feeling low, so you're looking for a high, and so the best way for that high is maybe go to your fridge and you have something sweet. And you will hear diabetics speak of this. Yes, the this feel or want to have something sweet. The craving, yeah, that's the word. Craving for something sweet. And it just has to do with the insulin levels in the body. And so when there is an insulin spike, then is when they will crave it, right? Because the hormone is like the soldier there waiting to do something, and it has nothing to work on. So the body feels like I should have something sweet. And so, yeah, you have a candy or a piece of chocolate. I recently tasted baklava Dubai chocolate, and it's like the best tasting thing in the world. So if you have that in your fridge, you'll definitely run for that. So yeah, so like we are speaking of treatment for diabetes, and it's diet, it's exercise, and it's medications, or what we would say pharmacological treatment. So exercise we spoke about, and the recommendations are um, 30 minutes a day, 5 days a week, so that you can get a total of 150 minutes per week. And this is based on studies that they would have done. And, exercise, when you exercise too, there's uptake of glucose. And so that aids in the reduction of the sugar level, right? Because your muscles are using it up as well. So I've had my own experience with going to the gym and what the levels are as well. And so, I can attest to say that exercise does affect blood sugar levels. So it's not like a farce, or we're trying to promote Alyssa's profession or her gym or something of that sort. And so diet, so usually what I would tell patients is not so much of I can't eat this or I can't eat that. You can eat what is within your reach or what is within your means. It's more so the quantity and quality of what you eat. And smaller, more frequent meals is the way to go, because then there will be more gradual release of sugar into the bloodstream. If we charge up on a plate of rice and dal for lunch, it's too much at once. And so, you're already struggling, pancreas is making a little bit of insulin, and then you charge it up with lots of sugar, and it just backs off. And of course, added to that big meal, what we do after we eat, is also important. We may, just take a little nap in the hammock or on the sofa, and then the belly gets bigger. And so with that central fatty tissue, the obesity, then the insulin resistance becomes even more of an issue. So yes, eat what you have within your reach. Go for more wholesome foods. All right. So we would usually advise patients to opt for whole wheat and whole grain products. So we'll say brown rice, and not parboiled rice, but actually brown rice. That means just shelled paddy, if you can think of it that way. That's what brown rice is. It's rice in its most I say would say wholesome form. Um, and then in terms of anything made from flour, anything made from pasta, anything made from provision, or any peas or beans, they're all within the starchy category. And so in terms of quantity, as a diabetic, you don't want to do more than what the size of your fist is. So this is your fist. This is what it should look like in the plate at that meal time, whether it be breakfast, lunch, or dinner. So your fist for your body. Don't eat my fist because it might be too much or too little for you. Yeah. So it all has to do with your body and your fist. And this is equivalent to half a half a pint or half a pound or a kitchen cup, right? So maybe not everyone would have a kitchen cup in their kitchen, and so the next best thing is a butter bowl. Every Guyanese has a butter bowl. So the half pound one though, right? The half pound butter bowl is what you use to measure your cooked rice, your cooked provision, your cooked pasta, or your chana or black eye or whatever beans you like to have in that way. When it comes to bread, that's equivalent to 2 slices of whole wheat bread. Would usually advise against tennis rolls because they add a lot of sugar to the dough when they make that. And then the way to measure, also it's not a good way to know how much they're going to be putting in with a tennis roll. Um, on Of course, it's Guyana, so everyone eats roti. So your roti shouldn't be more than the 1 kitchen cup of whole wheat flour. That's the amount of flour you should really use to make that roti, whether it be the sada roti or the paratha roti. That's the one roti for that meal. Because if you choose, yeah, you may eat it for breakfast, you may eat it for lunch, you may eat it for dinner. And honestly, there's nothing wrong with having roti 3 times a day, or bread whenever you want to have it, or rice whenever you want to have it. I usually don't eat rice for breakfast, but I do it when I go to India, and they serve rice for breakfast, and I'm fine. It's one of the times I'm finest eating rice for breakfast. So technically, nothing is wrong with it. Because yeah, still a lot of patients will come and say, "Oh, doctor, I stopped eating rice and I stopped eating roti and I stopped." And so I'm like, "What are you eating then?" Because we become extremists. Yes, somebody says carbohydrates are not good for you, or carbohydrate metabolism is way off in diabetics, so they come off of all of the carbohydrates. But it's not a smart thing to do, because then you'll be dipping in your energy levels. The carbohydrate is important in your diet for you to get energy so that you can do your things, you can go through your daily activity. So I would usually draw a plate, and I will say half of your plate is fruits and veggies. So it looks like this. So the thank you. So the veggies are the 2 palms of your hands, right? So that's the half of the plate, the veggies. And then the other half, quarter, is your fist for your carbohydrates. And the other quarter is your protein, which is the size of the fist of the hand. So not where the fingers are, or don't go across to the fingers and get greedy, but the actual fist of your hand. So this is your protein quantity. And all that I'm speaking of is for every meal, right? So it's not a daily thing also to misunderstand and say, oh, no, it's in the meal. So this is how you plan your meal. 2 handfuls of veggies, 1 fist of protein, and 1 fist of carbohydrates.
Good. You didn't scare us off. I'm going to starve now. Lisa, you want to add to that?
I think
thoughts?
going off of what Brother Vicky was saying about the carbs, people have it's a myth that carbs are what like cause diabetes, like sugar. But it's actually carbs, protein, fat, the whole of that meal that can spike your insulin. And I think we got into this whole, there's a thing called a glycemic index, right? Where they measure food based on how much it spikes your sugar. But it only gives parts of the picture, and that's carbs and what it does to your blood sugar. And there's plenty, a whole list of things that you can see with the carbs, but insulin index gives a whole picture. And it's something that you wouldn't find like huge lists of foods that are low on the insulin index, and which is better for type 2 diabetics on these, because it gives a whole picture of how carbs, protein, and fats affect our race. So it's not just about that carb, but how the entire meal spikes your insulin after. And some foods may have low carb glycemic index, but insulin index is up there. And I think more and more like research is coming on the insulin index. But like I said, it gives a much whole picture, and it's not just carbs. So people are like, oh my God, low carb, low carb, low carb. And actually that nice big piece of protein that you got on your plate there is probably making this meal high on the insulin in that aspect.
I just wanted to pause and ask if anybody has questions, comments on Zoom land or even in house? Are you all okay with the plate that they showed? Are you okay with the exercise that has been recommended? Are you okay with the don't go to bed after you've eaten, just take a little walk? Um, and again, it is definitely reassuring that you can eat that chocolate in the fridge, just don't binge on it. A portion, there's a little portion that you're allowed to have. Um, Anybody on Zoom? You can just unmute and speak. Tatiana has any you want to share, add? And definitely meditation. It's not just a word, but it's a way of thinking. Then when you look at it in a positive way, then one, of course, your stress will reduce, and it's a psychosomatic disorder also, right? So if you have positive thoughts, then it'll definitely affect calming your heart rate and your anxiety, because a lot of depression can also be involved in when I'm diabetic, because I'm doing all this, it's not coming under control. Many challenges. There's a wound, it's not healing, and it's not healing. I can't exercise. It's a vicious cycle. So how do I keep? No? So definitely meditation will help. Positive thinking will help. Healthy mind will help. You do some sitting exercise if I my hands and my legs especially, right?
Yes. There's different exercises based on your abilities, but if you can take care of your feet, like start from the ground up, like there's a muscle in your calves that they call the second brain.
The calf.
Second
Yes.
heart, sorry, not
Second
second
heart,
right?
yes.
And it's not the one that you see, it's the one that's underneath that makes you see that one. Right. And if you exercise that, it helps with blood flow back to the heart. So the stronger your feet, the stronger your balance, the stronger the muscles in your legs, the more blood flow to your heart. So these things, so sitting and just lifting your heels off of the floor.
Just show just doing the exercise. So they can just see, just a moment. Yeah, just your
Yes,
heels
this would
going
be
up.
the simplest one, just coming up and down here.
Yeah, do that again, please, both of you.
Yeah, they're little calf raises. So the two calf muscles, right, that I was talking about, one you work standing straight up, but this one in particular, you work with the knees bent. So that's why it's important when you're working the little heart, the second heart, you keep your knees bent. So you start off like this, and then you can progress to bent knees. You can hold on to the chair if you you bend your knees, and then you start with it standing. And as you get stronger, you go one, right? You go one leg, and then you can do incline where you stand on something, and so you can progress these. So you can start really, really simple, but your feet are so important. And I know with diabetics, it's hard to say like go barefoot, but you should be able to feel the floor. Part of diabetes, they lose a sensation in their feet. And I see that in my clients, their proprioception, when their inability to feel their feet, their balance is, yes, really, really off. And you have to protect your feet. You have to strengthen your feet are your first point of contact on the floor. So if they're not strong and people neglect it, I would definitely recommend starting with your feet. Strengthen feet, calves, then make your way up on these. So those are just little exercises that you can do that can help.
So just a little bit of addition there. So one of the things that also we will talk about in treatment for diabetes is foot care. And so, Alice is making mention of, increasing the strength and making your muscles work. And this one, I really like the one sitting, and there are no excuses because when you're sitting, you can do that, right? Um, but apart from that, there's a whole subspecialty within diabetes care, which is foot care. And they usually will talk to patients about how to take care of their feet, you know. And I have a whole 2-page here on the subject. And we're sitting here and we're beginning to think, I'm sure, that this is not a one-off conversation around diabetes. It's just like we usually tip of the iceberg. Yeah, we're just touching this. We're just scratching the surface, as they will say. So yeah, I think we can have follow-up talks around diabetes and diabetes care, because of the mere fact it does not discriminate. Any and everyone is at risk for developing diabetes. So as you've seen, kids all the way to old people. Um, and the disease itself does not discriminate in where it affects. It can affect almost every organ system of the body as well. So they will refer to it also as a silent killer. So yeah, I really think that we should and could continue to speak more around it. And of course, we want to make that link between meditation and taking care of ourselves, and of course we're taking one aspect, which is diabetes today. And diabetes could be a very stressful thing. I've had patients who have been in denial for months upon months that they're diabetic. So they come or they go to doctors and they're being prescribed medication and they don't take any of it. They don't take any of it, and they come for their yeah they come for their clinic visits and their sugars are HI. There isn't even a number. It's HI on the thing. And of course, the nurse gets upset first. And then she brings that upset to the doctor, and then he gets upset. And then the entire clinic becomes upset with the patient. But only to realize at the end of all the upset is that the patient is in denial. And so the way you take care of that patient takes a different direction, because now you need to talk to them about, what is it that is causing that disconnect between what is really wrong with you and you accepting it. And there are a host of things that could be responsible for that. Just bad experiences, watching a loved one, um, they've associated with it being, this really bad thing. And if it's a bad thing already, of course you don't want the bad thing. And so you pretend like you don't have it. And you think that it's doing something for you, but it's not doing anything for you. It's causing more harm for you, because every time your blood sugar is high, it's affecting your blood vessels. And every time your blood vessels get affected, you're at risk for cardiovascular disease, a stroke, a heart attack, diabetic neuropathy. We're talking about the sensations in the hands and the feet. You feel like you have a stockings on, or you feel like you have a sock on or a glove on, and it's not really there. But it's just that constant high sugars have affected the wrappings around the nerves, and then these get unwrapped and they become very sensitive. Um, and that's why you feel the pins and needles, but then also you lose sensation. And you walk on a pin or you walk on a nail and a piece of broken bottle and you don't even know. And then you present to the accident and emergency with a big infected ulcer too late, and then you lose a leg. And the stories can be really horrifying and horrendous. So what's better than to do preventive care what's better than to do conscious care? Yeah, so to do it, I think consciously is probably the best way to do it, because then you're taking care of yourself. It gives you an opportunity really to take care of yourself. Diabetes could be like a calling to more self-care, if you can think of it that way. And you see how many things it addresses, exercise, um, diet, foot care, and mind care. So, it's like you can start saying, "Thank God I'm a diabetic." You say, "Thank God it's Friday." You can say, "Thank God I'm a diabetic," because it's a blessing in disguise. To think of it in a positive way like that as well. I feel it's very inspiring, and it propels you to take care of yourself. And that's I was thinking of that too. It makes you disciplined. Yeah. It makes you disciplined because it really calls for a lot of discipline. It does. Yeah. So I'm watching the clock and it's 7:25. So we wanted still to leave the floor open for any questions if you have any.
Om Shanti.
Om Shanti.
I have two questions. So, first one, Diet Coke. They say no sugar. Is it safe to use? A second question. In the night, I tend to get very thirsty, but I prefer not to drink the water because of the fact I got to use the washroom very often. By not using the water, would it affect my body?
Okay. Thanks, Dave, for those questions. Do you want to take up the Diet Coke one?
Um, the research on Diet Coke is mixed, right? Yes, it doesn't raise your blood pressure, but long-term effects on artificial sweeteners are, it's now coming to light because it's a recent thing, So I wouldn't recommend a Diet Coke because one, it's empty calories. So when I say empty calories, it has no nutritive value. There's no nutrition in there. So if you had to drink a sugar beverage, please drink a juice. It's probably the same amount of sugar, but at least you had some minerals and vitamins in there. All right, some nutritive value. So when people come to me and say, "Oh, but juice got all this sugar too," I'm like, but it has vitamins and minerals.
That's
And,
good sugar.
right? And if you don't add more sugar to it, it can be really good. Not saying please don't go crazy on juice, right? Because it does have a lot of high sugars, but also don't buy into the artificial sugar of Diet Coke. When people tell me, "Oh, if it is helping you to reduce your calories, you have this goal or whatever, it's a good starting point, right? So if it takes you away from this like Coke or reducing your calories, because um it if you lose 5 to 7% of your body fat, you reduce your risk of diabetes by 50%. So I wouldn't knock somebody from trying to go a little bit lower on the sugars and calories if that is, I would like to wean you off of that. But if that is where you start, then I wouldn't knock you for doing it. Like you gotta go slow. And I always tell my clients, instead of removing things from your diet, how about you start adding some good things in? And the more things that you add in, like you. Okay. Yes. So the more good stuff that you add in your body will start to refuse the bad stuff that you're eating just naturally. because it will start feeling more and more satisfied because your body craves the nutrient dense meals. It craves hydration. It craves slow eating. So these things you want to pay attention to and listen to. And then you'll start weaning off all of the bad things. So don't just cut cold turkey because you're more likely to just get back on it. But just try adding some more veggies or, to your meals.
So I'm also I've always been skeptical about artificial sweeteners, because I mean, what kind of farce is that? I always thought it was like a fad or something, artificial sweeteners. I've had a personal addiction to Coke since high school days. It's the only thing that I used to drink, actually, Coke. And what did I do? I did what Alyssa said. I replaced it with um, colorful sodas instead. It's equally bad, but then I didn't have that issue with it burning my throat or causing like my esophagus to literally close off. Because now when I try to drink Coke, that's exactly what happens. It burns my throat so much that it causes like a close off of my esophagus. So it can't be a good thing. And to replace it with Diet Coke, it's like the tobacco patch to tobacco smoking, or the chewing gum to smoking a cigarette. So again, it's sort of like still fueling an addiction. Um, but of course, if it is an issue, then we want to address it in a gentle manner, in a compassionate way, also that Alyssa shared, because that's probably a better way than just saying, "Oh, it's a bad thing, and so I need to stop it." So replacement, it's a good strategy, because you remember we're accustomed to these things, and so um, not to take it away, but to replace it with something that's more wholesome. And fruit juice, I do believe it's a good way to the fresh fruit juices without the added sugars. My rule is nothing from a tin, nothing from a bottle, nothing from a packet, because anything that's refined also affects our blood sugars in enormous ways. So, imagine eating a packet of crackers that's made from very refined, I don't know what kind of flour. They have very fancy names for it. But when you eat that, it starts to digest in the mouth. So the sugar literally starts to digest in the mouth, and it gets into the bloodstream because it's so refined and so quickly digestible that it goes straight into the bloodstream. So, more wholesome cooked foods. The other question about not wanting to drink because you may pee. So when you drink and you pee, it just means that your kidneys are working well. Yes. And you need to be happy about it and continue to give it fluids, because the kidneys are very sensitive to fluid shifts. And so if you starve it of its thing, then it's going to cause the kidneys to get affected in the way it works. And if you're already a diabetic and you're already at risk for developing kidney disease, then on top of that, you don't want to do intentional dehydration that's going to cause the kidneys to get affected. So drink the water and pee it out. It's as simple as that. That's better, because then also, urination is a way of getting rid of toxins from the body as well. Because you don't want to become dehydrated, and then, because of that, there is toxin buildup and all of that too. So the simple answer to the question is drink and urinate. Yeah.
But if you're not diabetic and it's affecting your sleep, usually the rule is stop drinking water maybe an hour and a half, 2 hours before bedtime, so that so you don't wake up having to pee. But like Dr. Vicky said, if you are diabetic, you don't want dehydration to be a thing. So better you hydrate yourself and pee than be dehydrated and affect your kidneys. So yeah.
Well, can we say thank you to both our experts over here? We really learned a lot, do you think? All very silent listeners. But as you said, this was a teaser, and definitely we can go into the depths of it. It's an ocean. But to begin, start taking care of yourself, making a shift in the routine, in your diet, waking up, the quantity of what you eat, taking care of your blood sugar levels, taking your medications regularly, taking care of your feet, and incorporating exercise into our daily routine. It's a label, diabetes, but looking at it, yes, there can be different changes that I can bring in my life, which will prevent many other diseases, which could be leading from sedentary lifestyle or stress. So thank you to both of you to shining light on many aspects. So we'll just conclude with a few moments of meditation. Just sit back. You've heard a lot of information. As you absorb all of that, just bring your attention to the center of the forehead, behind the eyes. See yourself as a point of light, a being full of life. I hold a positive vision, a positive attitude, and a positive feeling for this costume called the body. This is an invaluable instrument, a vehicle for me to experience and express life. I take care of this instrument wholeheartedly and with respect and regard, because I know every choice that I make, whether what I think, what I feel, what I eat, and what I do, I choose to think positive. I choose thoughts that are elevating. I choose healthy food. And I choose to incorporate exercise in my life. Because this instrument is invaluable. And I am a special being of light in this body with a special role. Om Shanti.